Welcome to this Tutor to You Sociology topic video on work, poverty and welfare. In this video we're going to focus on private welfare. In this series we've looked at how governments have looked to create social policies to tackle poverty through state or public welfare. From the advent of the welfare state and the post-war consensus on social spending to the ideological rollback of the welfare state under the Conservative government of Margaret Thatcher, state provision of welfare has been the forefront of those needing assistance in society. However, when Tony Blair was elected in 1997, Labour, or New Labour, proposed a third way, one that combined state provision with private provision of welfare, arguing that greater efficiencies and a more customer-focused approach could be maintained through allowing private provision of welfare services. It was also argued that state welfare was costing the taxpayer too much, and that by allowing private providers to pick up some of the welfare concerns of the nation, this would be more effective. This approach was maintained by the Coalition and Conservative governments from 2010 onwards, with even further expansion of private welfare, that is, the inclusion of private and often profit-making companies, providing welfare services to individuals instead of the state. The increase in private welfare provision can be linked into the neoliberal ideology of the New Right and the government of Margaret Thatcher. Early attempts at introducing private welfare include the removal of free eye tests and dental care, arguing that these universal benefits should only be available for those most in need, elderly, children and those in receipt of benefits. The Conservatives also introduced private services within hospitals and education, which, whilst not directly welfare related, laid the foundations for what was to follow. Under New Labour, there was increased private investment in both the education service and healthcare, with new hospitals being built under privately funded initiatives, seen by many as one of the first steps towards the privatisation of the NHS. Furthermore, there was a decline in social housing, which led many people on benefits or low incomes to turn to the private sector to rent homes. While some argue that this gave them more choice over where they could live, it also brought with it insecurity and the higher costs of paying private landlords. Other examples of private sector provision have included the expansion of the private dental services and opticians. While some state provision remains, NHS dentists have become harder to find, forcing many to opt for private dental care. That is seen as being more convenient and customer focused. There has also been the increased use of private health provision within the NHS. This includes services that are paid for by the government and patients can access free of charge, and private healthcare, where individuals will pay health insurance and are able to access healthcare, often jumping waiting lists, even within NHS branded facilities. Under the Thatcher government, the decline in social housing stock was created through the sell-off of council homes to existing tenants, giving individuals the right to buy their own home, but also removing the burden of its upkeep from the state. And a final example of private welfare is the education system, one of the key drivers of social mobility, and how academies, free schools and other educational establishments are being run by private providers, albeit with funding from central government. There are advantages to the private provision of welfare, however. Private companies, as they have to compete for customers, are more customer focused, and this gives individuals more choice over the treatments that they may have or the schools that they select. While social housing offered little choice, individuals have, theoretically, a wider range of accommodation to choose from, and this means landlords should be in competition with one another to provide a good service. With healthcare, people, if they are able to do so, can choose to have alternative treatments that are not available on the NHS, or jump to the head of waiting lists. This is supposed to leave state services more capacity to treat everybody else, as those that can afford it will go private. However, this has not been the case in practice. Critics of private provision have suggested that it has created a two-tier system of healthcare between those that can afford it and those that cannot, with the more affluent getting treatments and educational opportunities that the most vulnerable in society are not able to do. Despite the calls for efficiency, spending on welfare, including pensions, healthcare, benefits, education and housing, has actually risen as a percentage of government spending to 34% in 2019, and significantly higher following the COVID pandemic, from around 25% in the 1980s. Many critics suggest that the increased spending is not improving welfare, but rather profiting private companies. Finally, the scarcity of welfare services as private provision increases, as we've already mentioned NHS dental services, but increasingly mental health and other services are not perceived as being essential, are being moved to private provision, and this boosts the profits of health companies whilst having a negative impact on the welfare of those who are reliant upon them. That concludes this Tutors U Sociology topic video on work poverty and welfare. Thanks for watching.